Children's pain reliever is used to help with mild to moderate pain, such as headaches, toothaches, and backaches, as well as to reduce fever. It can be taken for menstrual period pain, osteoarthritis, and cold/flu aches and pains. The recommended dosage for children is based on their weight and age, and it is important to follow the instructions on the packaging. It is best to give the medication with food to help prevent an upset stomach. Always consult with a healthcare professional before giving any medications to children. When giving children's pain reliever, be sure to use a product specifically meant for children. Use your child's weight to find the right dose on the product package, and if you don't know your child's weight, you can use their age. It's important to shake suspensions well before each dose and measure the liquid medication with the provided dose measuring spoon, dropper, or syringe to ensure the correct dose. For rapidly dissolving tablets, chew or allow to dissolve on the tongue, then swallow with or without water. For chewable tablets, chew thoroughly before swallowing. Do not crush or chew extended-release tablets, as this can release all of the drug at once, increasing the risk of side effects. It's important to take pain medications as soon as the first signs of pain occur, as they work best at that time. Do not take this medication for fever for more than 3 days unless directed by your doctor. And for adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. If the child has a sore throat, especially with high fever, headache, or nausea/vomiting, consult the doctor promptly. And always tell your doctor if your condition lasts or gets worse, or if you develop new symptoms. If you think you may have a serious medical problem, get medical help right away. If you experience any unusual effects from this children's pain reliever, be sure to contact your doctor or pharmacist right away. Most people who use this medication do not experience any serious side effects, but if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to remember that the benefits of using this medication, as directed by your doctor, outweigh the potential risks of side effects. And if you notice any other effects not mentioned here, don't hesitate to contact your doctor or pharmacist for advice. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. It's important to be cautious when using children's pain reliever, as taking too much acetaminophen can cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. For people with liver problems and children, the amount of acetaminophen should be less. It's best to consult with your doctor or pharmacist to determine a safe dosage. It's important to note that acetaminophen is present in many non-prescription and prescription medications, such as pain/fever drugs or cough and cold products. It's essential to check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you are unsure. If you take too much acetaminophen, overdose, it's crucial to seek medical help immediately, even if you feel fine. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may harm your liver. Therefore, it's important to avoid alcohol when using this medication. Before giving acetaminophen to your child, it's important to talk to your doctor or pharmacist if your child is allergic to it or has any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to seek more details from your pharmacist. Before using this product, inform your doctor or pharmacist about your child's medical history, especially if they have liver disease or if they regularly use or abuse alcohol. Liquid products, chewable tablets, or dissolving/effervescent tablets and powders may contain sugar or aspartame. If your child has diabetes, phenylketonuria, PKU, or any other condition that requires them to limit or avoid these substances in their diet, it's important to use these products with caution. Ask your doctor or pharmacist about using these products safely if your child has any of these conditions. If you're pregnant, it's important to tell your doctor before using this medication. Acetaminophen can also pass into breast milk, so it's best to consult your doctor before breastfeeding. Be aware of potential drug interactions with children's pain reliever. It's important to keep a list of all the products your child is using and share it with their doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without the doctor's approval. Some products that may interact with this drug are ketoconazole, levoketoconazole. Additionally, this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know your child is using this drug. If you suspect an overdose and the person has severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Acetaminophen is a pain reliever and fever reducer that is safe for children. It does not cause stomach and intestinal ulcers like some other pain relievers, but it also does not reduce swelling like those other medications. It's important to consult with your doctor to determine if acetaminophen is the right medication for your child. When giving acetaminophen to children, always follow the recommended dosage based on their weight and age. It is typically given every 4 to 6 hours as needed for pain or fever. Always read the label and use a measuring device to ensure accurate dosing. And remember, never give adult-strength acetaminophen to children. If your child is taking this medication on a regular schedule and misses a dose, give it as soon as you remember. If it is close to the time for the next dose, skip the missed dose and give the next dose at the regular time. Do not give a double dose to make up for the missed one. Keep children's pain reliever at room temperature, away from light and moisture. It's important to store it in a safe place, out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless you're told to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.